The patients are often teenagers or barely in their 20s, yet several of them hobble in on walkers to physical therapy. These women suffer from fistulas, ruptures in vaginal, sometimes even rectal tissue, a humiliating, even crippling consequence, in most cases because of obstructed childbirth.
They're leaking urine, and some of them are leaking bowel contents as well.
Dr. Catherine Hamlin and her late husband Reginald came to Ethiopia in the 1960s as Christian missionaries and founded the Hamlin Fistula Hospital a few years later. A memorial to her husband invokes the Gospel of Matthew.
Whatever you did for one of the least of these, my brothers, you did for me. It's in the Bible, it's my brothers, isn't it? But we all say brothers and sisters.
Yes.
The least of the patients the young obstetrician saw were those with fistula. Amid a lot of suffering, Dr. Hamlin says, the fistula patients were especially desperate.
She's smelling, she's poor, she's got nothing, and she's an outcast from her whole society, from everything that makes her happy. They lie in bed thinking, if I keep very still, the urine will dry up. They curl up in bed. They become stiff, their knees become contracted, their hips become contracted. They get nerve damage to their feet. The sciatic nerve is pressed on by the long labour, and they've got paralysis of their feet. They can't bring the foot up.
Fistulas were common across the world until the early 20th century, when prenatal care and modern systems of delivering health care, like caesarean sections, became available. Today, fistulas are almost unheard of in richer countries, but 2 million women endure them in the developing world.
For me as an Ethiopian, the fact that fistula is happening in the 21st century is not something that we are proud of.
Dr. Yetnayat Asfaw works with a non-government aid group called Engender Health. She says the big issue is access to care in the vast, impoverished rural areas of this land of 82 million people, plus myriad cultural practices.
84% lives in the rural population. So the majority are rural women. And for rural women, the issues are many. One, women don't have access to education. There are also several cultural issues, such as harmful traditional practices. Female genital mutilation is one. Early marriage is another.
Complications from the practice of cutting external female genitalia and other trauma, like rape, are thought to cause about 20% of fistulas, but the vast majority are a complication of obstructed labor, which results both in stillbirth and permanent injury to the young mother.
The pelvis of the woman is too small for the baby to come through, or the baby's in a bad position inside the woman. So my husband used to say it's either the passage or the passenger. The passage is the pelvis that it's got to negotiate to get out, and the passenger is the baby, which if it's not lying in the right position can cause the obstruction. So this was done yesterday, and she's...
Vaginal and rectal fistulas can be repaired surgically, and Dr. Hamlin, who is 87, still performs many of the procedures, like this woman's case. We were asked not to use patient names.
3 days of labour, and then she had a stillborn baby, and then she was left with a vaginal fistula in the bladder, and it was quite, it was reasonably difficult one.
What's the period of convalescence then?
I think in about 10 or 12 days.
She's better off than most women here. Many have lived with their injuries for years, too late to be repaired even with surgery. Hospital services are free, but transportation is often unaffordable if they can get a ride.
So how far away has this lady traveled to be here?
It's about a 4-hour drive away.
4-hour drive, which for her would be in a bus ride maybe?
She would come in the bus. She came
With
in
the bus?
Yes.
Which sometimes is difficult for them if
Yes.
they're
It is
smelling.
difficult. And sometimes the patients, the other passengers say, this woman's smelling, put her off, she's got some disease. And they'll be thrown off the bus.
Yeah.
To offer better access to its services, the Hamlin Hospital created 5 satellite facilities like this one in the rural countryside. They are funded entirely by donations from governments and private, often church-based donors. Still, only a third of the 10,000 Ethiopian women who develop fistulas every year receive any care for them. That's why experts say it's important to shift the focus from repairing fistulas to preventing them. Ethiopia's Minister of Health, Dr. Tedros Ghebreyesus, says a holistic approach is needed.
We need to focus more on the community-based interventions and on preventing fistula. The most important issue, it's the education part, which will be very important, and also law enforcement, like age of marriage is very important. Girls' education is very important, and we're working on that.
His ministry has won praise from public health experts for building a network of rural health centers in recent years with a major focus on maternal and child health, but there's still a huge shortage of skilled people to staff them.
Anterior, posterior, antero-posterior, and anterolateral.
A few years ago, the Hamlin Hospital began a 4-year midwifery program. These freshmen were studying plastic models of the female pelvis, learning how to detect abnormalities in the fetus position.
In the pelvis, in this way. So which fontanelle should you feel?
So far, 24 graduates have gone on to staff regional health centers in rural areas. A small, promising start, says Dr. Hamlin.
We just have to keep the next generation of doctors and nurses inspired to help these women until it's eradicated from the countryside. And it can be eradicated, and it will be eradicated. In England, obstetric fistulas no longer occurred after 1920. So it's not so very long ago that fistulas were occurring in England and in Europe.
But Ethiopia, like so many developing countries, has a long way to go. Most Ethiopian women today still deliver their babies without the presence of a skilled birth attendant. For Religion and Ethics News Weekly, this is Fred DeSam Lazaro in Addis Ababa, Ethiopia.